The Open Therapy Institute is addressing bias in mental health care. Go to our website, opentherapyinstitute.org. We have CE credit workshops about overlooked issues in the field. You can go to our workshop page and register now and become a member. And for those looking for a therapist, we match people with someone who's highly skilled and truly open. Just contact us through the contact page on the website or email us at info@opentherapyinstitute.org. It's nice to talk with you today, Andrew.
It's good to see you.
So I think we were going to have a chat about kids and therapy. And I'm curious to know kind of what your thoughts on this are. It's a really big topic. Is therapy good for kids? Is therapy not good for kids? Is there a gray area? And I have some thoughts on this. I don't know if you want me to lay out my thoughts first or if you'd like to just kind of give us your background understanding.
Um, why don't you start? Why don't you start?
Okay. So I tend to think one of my concerns when I was going through graduate school was how many of the students were there to work with kids, how many people professed an interest in working with children and adolescents. Most of these people were childless and young, and uh, and the program that we were being educated in had a very particular view of child development and a very strong activist social justice bent. And so at the same time, after the COVID lockdowns and school shutdowns, we have increased funding for counselors in schools. So we see a desire in the school systems to have an increased number of counselors per capita for students and access for kids to counselors. At the same time, a lot of states are pushing mature minors doctrines through, which says that after age 12, I think it's 12 or 13, parents no longer have access to their children's medical records. I know that's the case in Washington state, and that's for routine primary care as well as mental health therapy. So in just the past couple of years, we had a case that was really highly publicized here in the county where I live of a student who had been put on SSRIs without the knowledge of their parents, prescribed by a school counselor or the school mental health center or school health center. And so you see that's a pretty radical intervention. And the parent was not allowed to know about that. It was shielded from the parent. My concern with a lot of this is that with with kids, therapy is not a benign intervention. It's actually something that can change the course of their life. And when we're introducing some of these therapeutic concepts and processes to a young person away from their family of origin, who comprises their primary social support network, and the people who know them best and love them and who are more constant and consistent in their lives than any other social entity at this point, we are potentially driving a wedge between the child and their family and encouraging development in a direction that's not holistic and not in keeping with the family system structure. So I think I am concerned about the degree to which it's normalized for kids to see therapists. I think I can conceive of situations in which it's very appropriate to send your kid to a therapist, but I think it's all too often being treated as a benign intervention, and I'm concerned about it for a variety of reasons that I could go into more, but that's kind of just a backdrop for what I'm seeing right now and some of my thoughts on it.
Did you have an example, or was there some situation that you saw where a kid went into therapy and you feel like that caused big problems with the family or the for the kid?
Yeah, I have a number of examples, including my own. So when I was a kid, I was I believe that I had undiagnosed ADHD.
Mm.
And whatever you think about ADHD, some people think that it's overdiagnosed, some people don't. I have reasons for why I think this sort of developed in my life very suddenly. Um, I had, so I don't, that'll be a long story if I try to go into it. But when I was in about fourth grade, my grades really plummeted, my academic performance really plummeted. And I had been a so-called gifted kid with the really high test scores in on the standardized tests that they give out, the ITBS and things. And so I was always in the gifted programs throughout school, but suddenly my performance really tanked. And so for the way that I was later educated, we know that when we see a student whose performance doesn't match potential, we have to investigate for potential learning disorders. We want to look and see what's going on neurologically. Is there something that a kid isn't understanding? What's the problem with the attention issue? But for me at this point, it was treated as if it must be an emotional issue. So I was taken in by the school and put with a counselor every week for an hour for a class period. I was pulled out of a class every week. And the suspicion was immediately on my family. So there were lots of questions. There were anatomically correct dolls. There were questions about molestation. There were questions about sexual abuse that were being put into my head as a, what is fourth grade? That's like a 10-year-old or so. And it was really troubling. And it really caused me a lot of distress. I was extremely uncomfortable going in to see the counselor, and I became more uncomfortable with my family too, because I didn't feel like I could tell them what I was being asked in these sessions. So that's my own sort of initial background as me. But I also have talked with in more present day, I've talked with a number of families who I get requests frequently to work with kids as a coach because people are concerned about what they're getting when they put their kids into therapy. And in these interactions with families, I have been told at least, I guess, 4 or 5 times now, the therapist transed my child. My
Mm,
child was in therapy and the therapist started to suggest gender things, and the therapist helped my kid to implement social transition without talking with us and helped coach the kid to come out to us and then supported the kid so entirely in the trans identity against us, even in meetings together, that it was this alignment on this collusion between the therapist and the child against the parent. So I've heard that story several times.
right.
One more recently that was really shocking, where the parent became alarmed at some of the things that were going on in the therapy that the child was telling her about and tried to discontinue therapy with the therapist. And the therapist informed the parent that because the child was a mature minor, I think 13 or 14 years old, the parent was not able to discontinue those sessions. Only the child could cancel therapy.
Mm.
And so this was really alarming to the parent. It's really shocking to me as well. So those are just a couple of examples, and I don't know if those just represent sort of an extreme tip of the iceberg, but yeah, I do have a couple of examples of them.
It does. It's to me, it sounds like there's maybe biases in terms of how the therapy is being practiced, particularly in those cases where uh, maybe there's a particular ideology that's driving care that's
Hmm.
maybe attuned to the kids, but also maybe a lack of a value in the field for like kids are probably going to be better, feel better, and have a better outcomes if they have a good relationship with their parents, and that's not a um, antithetical, it's not antithetical to therapy. It's totally compatible with it.
Hmm.
Um,
Hmm.
uh, I think that I think I might even go further. I think kids probably need to be taught that maybe like part of my like philosophy of like mental health is like I think what ultimately leads to the most fulfillment for people are having good qualities, and it's being a good person is really good for mental health when that's like sincere and authentic. I think that that leads, so it's things like being more patient, being more forgiving, being more compassionate, being authentic, being assertive, these types of those types of good qualities are what I think lead ultimately to the most fulfillment and the most thriving. And for a kid, part of those good qualities involves respecting parents and teachers and being grateful for the ways that they help and support you and things like that. I think to my mind, that's a broad blind spot maybe across our entire culture. I mean, I definitely can see it being something that gets missed in therapy, maybe especially therapy with kids. I can see people not thinking about that as something that's going to help the kids and help the family. Um, but I think it's something like across the culture that it's like not really a value, or maybe it's even seen as oppressive,
Mhm.
or something. Like there's this discomfort. I think there can also be a discomfort with power imbalances that like the parents have more power than the kid. There's a reason why we make it that way. It's because kids can't run their lives when they're younger and they need parental guidance, and the parents aren't going to be perfect, but there is this kind of mutually beneficial power imbalance, and the parents are not the equals of the kid. That's really important for family therapy, but I think it's also important to keep in mind with child therapy too, that like they're not there's a process of becoming more and more independent over the course of childhood.
Mhm.
And they do get to be at a point in their lives. They are fully functioning adults and get to make their own decisions. And but they have less autonomy when they're younger. And so therapists probably need to be mindful of that continuum as well. It sounds like I can imagine therapists falling into these cultural traps that don't acknowledge the power imbalance, don't acknowledge that the family is an important determinant of like having good family relationships is going to be good for mental health, or having good qualities is going to be good for mental health, or that they need to be careful not to impose some of these other ideologies on mental health or on the therapy. So I could see all of those being blind spots. I don't know that it's therapy per se that would necessarily be the problem. 4th grade is not quite talk therapy age for me. Sometimes people don't even get to comfort with talk therapy until 15, 16, 17, depending on the full range of who comes into therapy. Um, so there are other forms of therapy that aren't getting on the couch. I mean, I saw a kid once who was 7, and he came into my office and got on the couch. And I was like, no, no, let's go to the game closet and play a game. And it takes a totally different shape. Um, a lot of the processes are similar to psychotherapy, but I think kids communicate more through play and through games, and that's how they bond to people. And doing a kind of like reflective talk therapy with people too young, I think it doesn't work very well for them, in my
Mhm.
experience.
Yeah, I think that that's a really good point. And I think that if if I had heard if the training that I had received and the experiences that I've heard about and experienced myself had been more in line with what you're describing, which sounds like good therapeutic practice and it makes a lot of sense. You're just sort of mentoring someone and kind of helping them to realize, bringing them these good qualities, bringing out these good qualities, reinforcing some moral lessons and social lessons in a way. But the reflective, as you call it, reflective talk therapy, this seems like it could be damaging for if you're trying to implement this with people that are too young, because there's sort of an inventory taking that can happen at a
Yeah.
time when a person doesn't really have that much agency.
I would say just about the moral piece. Like I really try not to be moralizing in
Mhm.
sessions, but to the
Mhm.
extent that I'm thinking about what's going to be bring fulfillment to this person, that
Mhm.
is on my mind. And if they
Mhm.
want to know my thoughts about what ultimately leads to fulfillment, I
Mhm.
think it is those things. Um, and they don't have to agree with me, but I'll be, that does shape my thinking. I think the way that play therapy works is you just let the play happen, and it takes a while for them to get comfortable with it and comfortable with you.
Mhm. Mhm.
And you're not even necessarily sure where it's going at first. But one thing that you often do is you're labeling the affect. So if you've got little figurines and they're playing house, it's like, oh, like let's have like let's have dinner, and or you're labeling like this is fun, or like this is or they're fighting and they're like I'm upset, or you do label the affect in the play. And what you often find is that the games reflect the struggles of the kid.
Mhm.
And it's kind of like often with more clarity than in talk therapy with adults, you get a real window into what they're feeling. With one kid, I played a game where he was Invisible Boy and I was a monster and I was trying to get him. And then if I got him, then I would actually put him in the oven and cook him and then eat him. And there was this whole game that was played, but there was something about um, it related to his family about really feeling unseen
Mhm.
and really wanting to be wanted and wanting to be desired, even in this kind of cannibalistic
Mhm.
way. Like it's weird to like have this game that like turns into the cannibalism, but it's like that I to me, I felt this is how intensely this kid wants to be desired and feels invisible to his parents. So it's like it's very evocative. And a lot of those things can be somehow they're processed just like with talking with adults. Sometimes people say it and that's enough. And it's not like it needs like a solution per se. Like they kind of got it out and processed it and made sense of it on their own. And sometimes that can happen with play, but sometimes you can have an intervention with the play that is in the context of the game that communicates the same type of thing. So I saw a kid who was moving, and it meant that we weren't going to be able to continue the therapy. And in the last sessions that we had, he actually would get sick and die in the game. And then I would bury him and have a funeral for him.
Mhm.
And I would give a eulogy for him that would say, um, I'll always remember him, and
Mhm.
he meant so much to me, and I think he's in a better place, and I know that he's going to be okay. And we're playing the game, but it's clearly about ending therapy and his move.
Mhm.
And you communicate those things through the play.
Mhm.
So I wasn't trying to foster a kind of like adult reflexiveness in him, but it was really clear that these processes were getting processed through the game. And we probably had in our last weeks of therapy, we probably had a funeral every session. I remember one he gave me a watch.
Mhm.
He took his watch off and he gave it to me, and he's like, this is like what I was inheriting was the watch.
Mhm.
And you can just think about whether that's about watching over him or if it's
Mhm.
about time um but it was just important to like accept the gift and be
Mhm.
like, I'm glad I have this to remember him by and just to play it out. So the play can get really real. And I think on some level he knew something was happening, but it has this more unconscious quality. And um, but so yeah, I think you're right. Like if for me, if I had, said we're, tried to put him on the couch and have adult level conversations about reflecting on his family, I don't think that would have been appropriate to this kid. It got processed, I think, much better through the play.
Those are really beautiful stories. And I wonder, as you're telling that, how do you distinguish between significant subconscious material and imagination or scripts that he's picked up from some cartoon he's watched or something? So how do you make sense of all the things that are coming up in play?
Yeah, that's so, I mean, it's partly like empathy and like
Hmm.
you're attuning to like what your emotional resonance is with it. But, you kind of want to look at what's unusual, what's repeated, and what's really emotionally resonant,
Hmm.
or like striking in a certain way. So those two games, The Invisible Boy that I would eat and The Funeral, were both games that were repeated over multiple sessions, and he'd come back ready to start playing Invisible Boy. And there was a period where, you know, maybe 2 months we played Invisible Boy every day, every time we met. And so yeah, I think that's kind of what you look to. You kind of look for your clinical intuition. You think about what fits with
Hmm.
this kid. It's not uncommon that you would see them play something that you think they saw, or versus experience. Sick kids with medical issues often want to play doctor.
Hmm. Hmm.
And
Just
you
a
can
part of
just,
their life.
it's part of their life, and the games like, are gonna, sometimes they're like exactly obviously what happened to them. I mean,
Hmm.
it's just, or what they're worried is going to happen to them, and the
Hmm.
patient dies, or
Hmm.
they're in lots of pain, or so it's not, but even the more physical play can have this kind of dimension. So one game that I played once early on in treatment with a kid was catch. And but he would the way it worked is, I think we would throw it back and forth, and I think if I caught it, you'd take a step closer.
Hmm.
And then if he caught it, he'd take a step closer. And then if we got all the way to him,
Hmm.
if I got all the way to him, then I'd like get him. And he'd like
Hmm.
giggle. But it was like, but I got him, you
Hmm.
know? So there was this, obviously, this is about approach
Hmm.
and connecting to each other and how comfortable how scared he is, but kind of desiring the
Hmm.
connection, but like afraid of it. And we're playing this kind of back and forth about starting therapy. So it's like even something like catch can have these, you know, meanings, that are then, reflective of what's on their mind. And but it's helpful just to have like some training about it and some
Hmm.
reflectiveness about what's happening. And it may be, one thing is, it may be that the age of play therapy is getting higher, and
Hmm.
that reflective therapy, like maybe kids in previous generations could do more at age 15 and than they can now. I get the sense that kids maybe have a harder time talking in an unstructured way
Hmm.
at an older age. Um, but there is this really awkward age that I think is very difficult, where they're not quite ready for talk therapy, but they feel too old for play.
Hmm.
And you've got to figure out what you're going to do to ground therapy. And I think it's challenging. Sometimes you do questionnaires, or you can do puzzles, or you can have a semi-guided, more task-focused conversation. It's sometimes there's a tricky age.
One thing that's really refreshing in hearing you describe this is how thoughtful and intentional you are about all of these aspects of the connection. And I wonder, what are your thoughts on the collaborative process with the child's family? Because that's one of my biggest concerns in what I've experienced and heard about from other people. And is is this division between the child therapist connection and the family. And I know there's going to have to be some degree of confidentiality, or else you're not going to have the trust of the child. But a collaborative approach seems like in some way necessary if you're working with someone who's still very young.
Yeah, when I was working with the 7-year-olds and the really young kids, I wanted, and parents don't want to do this for the most part, but I wanted to meet with parents every week.
Hmm.
Now, I had some people who were willing to do that, but a lot who weren't. They're not in therapy, the kid is.
Hmm.
But I got a lot out of the parent sessions, and the parents are like so huge to understanding what's happening and responding. So it's like every week they mostly don't want to do that, so it's usually like once a month is what they're comfortable with.
Hmm. Hmm.
They um as they get older, I mean, I get requests to have monthly parent sessions with kids who are in college.
Hmm.
This is a generation where the parents track their cell phones into adulthood. I know people whose parents would say they're not allowed to spend the night in their own home overnight without the parents present until they're 18,
Hmm.
or just things like that, just
Hmm.
like, so I think for them, they feel in that culture, there is a desire among some to like well into adolescence know everything that the kid is talking about.
Hmm.
And that's not that's not ideal. The
Hmm.
kid does need to be a little bit individuated, and especially teenagers. Um, if everything's going to get reported back to their parents, they just won't talk a lot of times, like, or they'll be fake, or it's not going to be as useful to them. They have to know that there's some protection from what gets back to their parents. And I've been put in really awkward situations with this. One kid he was actually a freshman in college, so he was already older, but he had developed a smoking or
Hmm.
nicotine addiction. And that was something that he really wanted help with and was concerned about. Um, but he's like, but you can't tell my parents I'm smoking, and so because I'll get in trouble, but I want help with this.
Hmm.
So being triangulated between the kid and the parents is so common in child therapy. And it's one of the reasons why I think people don't want to do it. It tends to be much more expensive, and a lot of people don't do it. And it's a big part of it, I think, is that because
Hmm.
the parents want to know more. Whenever I got something that would be like the parents would say, you know what, he's not making more progress. We want him to make more, like kind of pushing me to push the kid.
Hmm. Hmm.
Most of the time, if I act on that with the kid, the treatment's over.
Hmm.
It's going to ruin everything. And it's like, so you're constantly managing these tensions. And with kids, they're kind of like, okay, you're playing games with the kid. It's been 2 months, where's the behavioral change? You're kind of like, this is going to go at a different pace than what you're used to. But it's like, oh, we're just supposed to trust you and keep paying you every month for how long? And so it's very hard. And I think it's one of the reasons, like, again, why a lot of people don't want to do it. Um, uh, yeah. And I do like the idea of the parents knowing what's going on. I'll tell you, I've explained some of the play stuff that resonated with you to parents, and they were like, I don't get it. What are you
Hmm.
doing? Why is that so important? And they'd be like, he's playing. That's all he's doing
Hmm.
is playing. The issue is behavioral issue or something like that. They're like, he's getting in trouble in class. But, I'm thinking, well, you know what? If he's Invisible Boy and he wants to get eaten, maybe that's a clue to why he's acting out in class.
Hmm.
But to them, I think to a lot of parents, that just sounds like such bullshit. They just don't want to hear it. And so they're disappointed a lot of times. It's very hard. It's much easier to work with adults because they have the goals. You can outline the treatment to them directly. You
Hmm.
don't have this third party you're trying to manage, and it tends to they can either believe your treatment approach or not. And if they
Hmm.
don't, they can leave, and if they do, they can stay, and it's much more straightforward. So I think child therapy is really hard.
Yeah, and what do you think about a parent coaching approach? Because that tends to be something that I lean towards in terms of the parents being the best situated to implement any interventions or change things that are going on within their child's daily patterns.
Totally, totally. That's always great. And even like family work, if
Hmm.
they're open to it. But families tend to hate family therapy. It's very hard. It's really hard on everybody because you have the other family members in the room to call you out on your BS in
Hmm.
a way you don't when you're in individual therapy. And so it tends to be taxing. There's lots of arguments. Everybody's kind of worried about it's hard. So they tend not to want it. But family therapy is a great option.
Hmm.
And parenting coaching can be really good. The kid sometimes needs a voice and support too. Um, the good thing about if parents are seeking parenting coaching, that's also probably like in a good factor indicating it's going to be successful because the parents are like, we're open to change and looking to ways we can change to make things better. That's already great. If they want to dump the kid off and be like, this is on the kid, it's already going to be harder.
Hmm.
Like there's going to be something the parents are going to want to do differently, right? I mean,
Hmm.
but and they're sensitive to being blamed, and there is this kind of cliche in the field that like the therapists just blame the parents. So it's good if they can be brought in collaboratively, I think.
Hmm. Hmm. I wonder about the degree to which LGBT ideology is really changing children's therapy processes, because that's one of the things that I was alarmed by and really noted when I was in graduate school was the talk about the trans child, and this the trans child is this ultimate figure that needs protection from everyone, almost especially his or her parents, because the parents aren't going to understand and they're going to try to do conversion, and this is a matter of life and death. and
Mhm.
and I find this so strange that we would think about this one issue differently than every other issue that could be coming up for a kid, and
Yeah.
that this would be a particular topic or identity constellation that merits a strong intervention and the therapist standing up for the child against the parents, or keeping extra secrets. And we see this not just with therapists but with teachers as well. It seems like this sort of school therapy, I guess I almost want to call that a collusion in a way. These new social justice therapists, the way that they're trained, the way that educators are being trained to protect these kinds of identity formations in kids against their parents. I think that this is pretty alarming, and it's strange to me how it seems to create an exception to all these other classically understood aspects of development.
Yeah, I mean, well, and classic principles in the field. I mean, when I did ethics trainings for IRB for a study or whatever it is, and you have to take these ethics modules, one of the key values in psychology and in mental health is informed consent.
Mhm.
And I was always taught about it the same way, which is adults consent, kids assent. And
Mhm.
that means before age 18, you need the child to consent to assent to treatment, and you need the parents' consent. So I would never see somebody even 17 years and 11 months old. You need parental consent to do the treatment. Um, I think that was such a bedrock ethical principle for throughout healthcare and science. It's shocking to see something like that get upended. And I think the core my stance on it is if you're gonna interfere, between parental consent and childhood assent. You need to have really, really, really strong evidence for why that's absolutely essential.
Mhm.
And that would mean you'd need a large body of very well-designed longitudinal studies showing that this intervention that you're doing is beneficial.
Mhm.
I mean, you kind of want all medicine, all therapy to be evidence-based anyway, and for everything that therapists are doing to have a body of evidence and that's robust. But that's just doubly true if you're going to violate parental consent. And it's been shocking how quickly this core ethical principle of assent and parental consent has been upended on this one issue in this very peculiar way, where there isn't this large, robust body of evidence, and a lot of it is it's just not supported.
Mhm.
So it's really shocking.
Well, given that this is happening broadly in a lot of areas, I know it's happening in Washington State. Do you have any suggestions for families who are considering therapy for their kids? How do they go about finding someone that's a good match and that's going to be supporting their child within the family structure?
Oh, that's a really good question, and I don't think I have a great answer for it. That's a one size fits all. I can see examples of it going in each direction. I can imagine the helicopter mom who tracks their kid's cell phone at 17 and then wants to hound the therapist to get every last detail, and that's not the way it should go. I can also see the example of the therapist who's taking the treatment in a radically non-evidence-based way and won't hides behind confidentiality to keep well-meaning parents out of the treatment. Both of those are extremes, but I think they both happen.
Mhm.
And it's very tricky. And and you just don't want to paint with too broad of a brush of like never have them do talk therapy or always do this or that.
Mhm.
It's just it's one of the problems. I mean, I think that makes it so hard for patients. I don't know how they find people. I mean, I look at there are institutions I know where I think the people trained there tend to be good, and I
Mhm.
can talk to a therapist and assess their clinical skill in a way that the average person can't. And it's
Mhm.
kind of shocking how at sea most people are when looking for a therapist, and there's a huge range in competency. And
Mhm.
and it's not always aligned with branding. It's not always aligned. I mean, it's not even aligned with like the prestige of the degree or something. I mean, I know people who went to Ivy League psychology programs, but what people probably don't know is those top psychology programs, they want to train researchers. And a lot of people in those programs don't do clinical work as part of their training. They might have some of the least amount of clinical training as anybody you'd ever see,
Mhm.
somebody who got a PhD from an Ivy League school. So it's so hard. I think that there need to be more. I mean, it's part of what we want to do at OTI is actually like vet people and have people that we can recommend and endorse as talented
Mhm.
therapists,
Mhm.
because I do think there needs to be some organizations that are doing that.
Mhm.
I think it's so hard for patients to just look at psychology today and get lost in names and
Mhm.
buzzwords and
Well, most therapists do some sort of initial consultation process so that they have a chance to kind of get acquainted with the prospective patient and the patient can ask questions. And I wonder if you have any thoughts on what are good questions and what is a good way to sort of feel out your therapist to kind of get a sense of what their practice is going to be like.
man, we should work on developing some type of interview for therapists.
Oh, yeah, that's a great idea.
It's very, therapists work in really radically different ways. A lot of times they'll say, like, you want to hear them say CBT, you want to hear them say this or that. I don't think that. I think there's a lot of people with different theoretical orientations who do good work. I yeah, and therapists can sell themselves a particular way. It doesn't mean
Hmm.
that they're going to do good work. Um, things aren't always clear after the first consultation about where things are going to go. Um, there's might be pressure to overpromise, which I don't
Hmm.
think is a good thing.
Hmm.
Um, no, I don't have a
Hmm.
list of questions. And I don't have I think the best would be to have like some sort of system of vetting
Hmm.
where people are kind of endorsed as skilled or not in a particular area and get some type of something that has more meaning than what we have now, which is
Hmm.
just getting a degree.
Hmm. Yeah, I love the idea of developing sort of some mock therapist interviews even and kind of running
What
through
would
what
you
that would
ask?
sound
What's
like. That's a it I am kind of just as fresh to that question as you are in terms of like what I think I would ask. I think I with social justice being such a and I say that like with trademark social justice because
yeah,
it's this whole set of ideological beliefs and it was so pervasive in the training program that I went to. I would
yeah.
kind of want to feel someone out to see where they are on those things just to get an idea of I think that asking someone how long they've been practicing might also give you a little bit of a sense of this. And it's not that newer practitioners can't be excellent. I think that there are excellent people who have come to this later or more recently. But if someone was trained and started practicing prior to this big ideological shift, you are that's an indicator that they may not have been as heavily indoctrinated into this. And then maybe being able to ask them some questions about it. If there are ways that you could ask about anti-racism training or gender ideology, what is ask these questions about it beforehand. And I think that that's going to be delicate because especially if you're afraid that the person is on the other side of that divide from yourself, that you're risking a really awkward conversation and you may really be wanting this connection to work, so it's kind of hard to put yourself in
Mm.
that position, but it's good to know up front. And I think that this is particularly the case for parents who are going to be, like you said, dropping their kid off and walking away. And I think I like your suggestion a lot about meeting with the parent meeting with the therapist regularly, if especially for younger patients, if you're
Good one.
working with someone who's pre-adolescent or early adolescence. I would like to know if I were a parent what the therapist's policy is on that and what kinds of things can I expect you to share with me with respect for the fact that some things that happen in the session are going to be private to that therapeutic relationship. How
Yeah.
much of that can I expect to get feedback on as a parent? Because it's important to me that this remains in keeping with our family structure. So this is I think I would want to know these things. How much feedback am I going to get? Are we going to have regular meetings? And then asking some questions around the race and gender ideology, whatever that looks like.
The key thing about the parenting meetings, I guess how I would think about them is
Hmm.
it's not pegged to age, but to the maturity level. It's pegged to where they are in psychological development. If they're a very precocious 15-year-old, they have a job, they drive, they put fuel in their car, they manage their grades and stuff on their own, like that's I think that they might be ready
Hmm.
for individual therapy where you don't have monthly meetings with the parents. That doesn't mean the parents never get updates, but I think there are people even 15 who are really mature. There are people who are 17 who are
Hmm.
not.
Hmm.
And it's just a wide range. So that's really the question is like where's their maturity level?
Hmm.
And that'll kind of determine how much parental engagement makes sense.
That makes a lot of sense. And that might not be something you know right away. You might have to learn that over the process of getting to know the kid. And
Right.
and the
But I
parent
do
might not
think
have a sense.
for young kids, like, yes, you should be having a monthly parent meeting. Even twice monthly meeting is
Mhm.
is good. And it's a good sign if the parents want that and they want to think not about parent if therapy has to be about the patient changing something in themselves.
Mhm.
It can't be the therapist somehow fixing it without the people having to change, or they just do make your kid do what you want them to do or
Mhm.
something. So if the parents are like, yes, we think there's things that we could improve too, we
Mhm.
want to learn what those are, and we'd like the parent coaching to be a part of this,
Mhm.
I would request it. And I think if the therapist denies that, I think that's a red flag,
Mhm.
unless there's some obvious extenuating factor.
Mhm. I wonder about this also. If you are uh, a parent and you are aware that your child is having some gender issues. This is I'll just draw sort of a hypothetical based on some situations that I know of in real life that I've people that I've spoken with. Child is having gender issues. You feel that this is a relatively new thing and you feel that it is socially motivated because you're seeing it happen a lot in the kids' school. But the child is closing off to you about it, and there's some behavioral issues and some emotional issues. And the child is asking for therapy because that's a frequent thing that I'm hearing as well, is that the kids are the ones requesting it. It's kind of a I don't know if it's a search for someone to talk to, a sort of a social badge of honor that you have a therapist. I think it's a combination of those things for some of these young adolescents. But the child is requesting therapy, and the parent is concerned that if they put the child in therapy, the therapist is just going to help to solidify what's going on with gender. How would you approach that with the therapist? How would you ask that question? Would you let them know this is going on and I'm really wanting to have someone who will take a neutral exploratory stance with my child?
There are organizations that list therapists who do take that stance, and obviously, like Therapy First comes to
Mhm.
mind. That would be organizations that I would look towards.
Mhm.
Or obviously Open Therapy Institute. I mean, it's like it's hard to you know, you want to know what their values are
Mhm.
in terms of how they're going to manage this. And they can couch it in vague
Mhm.
terms that sound patient-centered, and you don't always know if in the back of their mind they're thinking, oh, the parent's concerned about this, that means they're a bigot, and
Mhm.
I can disregard that. So it's a hard thing to gauge. I mean, sometimes it's not hard. I mean, if they're really activists, that can be clear on their
Mhm.
profile online, and it can be clear when you talk to them. But I think there is this kind of middle space. A
Mhm.
lot of therapists who I think are not necessarily bad therapists in a lot of contexts, but they have a bias on this. They might not be
Mhm.
sort of aware, and they kind of take the default stance, which is often to side with the trans identity if they see it. And they don't even necessarily see it as that.
Mhm.
In their mind, they're questioning trans because they are trans and they need help being supported to
Mhm.
overcome the stigma that they think they shouldn't be trans. So by siding with the trans identity, you're helping them be who they are.
Mhm.
And they don't see it as putting their thumb on the scales in a conflict that might be more complicated.
Mhm. Yeah, that's great advice. And there's GenSpect and Therapy First both have directories. So
Okay,
you
Jen.
kind of come back to that certification, or not necessarily certification, but that sort of alignment with an organization that has done some vetting. And so you have a better sense of who this person is rather than just that one-on-one conversation where a lot can happen.
Yeah, I think like yeah, looking for organizations that do vetting is very, very helpful for
Mhm.
all of the issues that we're talking about. Yeah.
Well, this is a big one, and I really appreciate you getting into it with me. It's a big conversation for a lot of people right now.
I know. I'm glad that we're talking about it. And to think about it, just to avoid, I mean, I think I'll say this, a red flag is extremism.
Mhm.
I think when people say it's always bad or when people say there's never a problem, those are
Mhm.
not voices that are very helpful.
Mhm.
So
Yeah.
it's good to get into some of the nuance of what's going on.
Yeah, I agree. Well, thank you so much, Andrew.
Thanks, Leslie.